Yes, today we are going to know about the instrument which is commonly kept in exam for pathology for exam going second year students. So first is the improved Newbar's chamber. So these improved Newbar's chamber, it is called as improved Newbar's. It is called as improved Newbar's chamber because of the lines which are seen in the Newbar's chamber are very clear. So these are usually the crystal slides which is around 4 mm thickness. So it is made up of usually. So it is made up of these 9 large squares. So each square is around 1 mm square. So this is usually subdivided for the convenient purpose for counting of WBC. So usually the center square, so whatever the center square here we are seeing is subdivided into 400 small squares. So this center square is subdivided into 400 smallest square. So each square is around 0.050 mm square. So by marking each fifth vertical and horizontal line, a double line like smallest square has been segregated into the 25 groups of 16 square. So as I said, this will be the counting area. So because of the concentration and the size of the RBCs and WBC, usually the central area is ideal for the RBCs. This is where we count RBCs. And also the WBCs are usually the lower in concentration. So these are lower in concentration, that is WBC. That is why we usually count in the corners. So as I said, it is divided by vertical and horizontal line. So usually it is divided into 9 squares. So 1, 2, 3, 4, 5, 6, 7, 8 and 9 squares. To 9 squares. So around which these 4 squares are used to count WBC, and each WBCs is usually again it is subdivided by 3 vertical and 3 horizontal lines. So total there will be 16 small squares. So this is how we use Newbar's chamber to count RBC and WBC count. So next instrument which is most commonly kept is RBC pipette. So RBC pipette, so it is usually it is the easiest thing which can be kept. So usually the parts of the RBC pipette we have to know. So this is usually the mouthpiece, and then this is the rubber tube, and this is the pipette with the bulb. So this bulb will usually contain red bead. So this capillary tube will open into the mixing bulb, which contains a glass bead which facilitate the mixing of blood and the dilute. So it helps in mixing. Basically it helps in mixing of blood and the diluent. And this pipette is usually used for RBC counting. So the dilution, the marking as it is written, the marking is usually the 101 on the red pipette, and also it is divided into 10 parts marked till 0.5 at the 5th mark. So then the dilution fluid, which is the dilution fluid which is used in this. So that is the Heim's dilution fluid, or other fluid like Desi fluid can also be used. So this is what I said. To count the red cells, the blood is drawn into the red pipette up to the marking of 0.5, and the dilution fluid is up to the mark of 101, and the dilution is usually 1 in 200. So these are counted on the 5 groups of the smallest, that is in that Newbar's chamber. Usually the center is used for counting the RBC thing. So it contains 400 such squares. So that is how we count. So the next is how is RBC count is done. So as I said, the number of cells which is counted and the dilution factor. So in our case, the dilution factor is 1:200. So if suppose example, this is the number of cells, this is the number of RBC cells, and this is the dilution factor. So ours is 1:200. That is why 200 we are using as the dilution factor, and also the depth of the Newbar's chamber and the number of areas counted. So total will be the so this will be the total number of RBCs. So what are the uses of RBCs? As I said, RBC count. So other than RBC count, it is also used for manual platelet count and also manual WBC count. When the total count is very high, we can use RBC count. So because the RBC pipette, it has the capability of counting more. So whereas RBC pipette is 1/1 is the marking point, whereas in WBC count it will be 11. So as I said, in WBC count, the marking will be 0.5, 1 and 11. So the capillary, so as I said, there will be parts, the mouthpiece, similar parts, mouthpiece, rubber tube, and opens into the pipette. So the size is usually smaller compared to the RBC pipette, and also it contains a glass white color bead. So usually white bead is contained. So this capillary tube will opens into the mixing bulb containing a glass bead, which facilitated diluent, mixing of blood and diluent. So basically, how do you differentiate WBC and RBC pipette? Depending upon the white bead and red bead. So as I said, the marking is 11 here. So whereas in RBC pipette, it will be 1/1. So always we have to remember that the first few drops should be discarded. Discard the first 3 to 5 drops to remove only the diluent from the stem. So each WBC pipette is provided with a aspirate tube, and the blood is drawn up to the 0.5 marking and the diluent up to the 11 marking. So the dilution factor is 1:20. So suppose for example, so as I said, it is counted in the 4 boxes, that is here we count. So these are usually the WBC which we count. So the dilution factor will be 10 here. So suppose the 90 is the WBC count, and 10 will be the dilution factor and 20 will be the average, the thickness. So total it will be 18,000 per cells. So next is the uses of WBC pipette. So manual WBC count. So other than WBC, it is also used to count the semen analysis and also CSF count. So manual counting of these will be helpful. CBC, so always remember WBC, semen and CSF. So what is the normal range of RBC? So normal range in male, it is around 4.5 to 5.5 million. So female it is 3.8 to 5.2 million, whereas in birth it will be up to 6.0 million. So where are the condition where we see there is increased RBC count. So one is physiologically, as I said, it will go up to 6 million, that is in newborn. So other conditions like polycythemia rubra vera and secondary polycythemia. Secondary polycythemia is like if there is any dehydration or hypoxia is there, especially in high altitude people, and also there is an increased erythropoietin production, especially in RCC or other pheochromocytoma. So those kind of things you will see secondary polycythemia. So where will you see decreased RBC? Decreased RBC, the majority we see is the anemia. Other than that, hemodilution. So these are the things where we see decrease in RBC count. So next is most common instrument which is kept is Salis hemoglobinometer. So always you have to pronounce correctly. Salis hemoglobinometer. So this is usually a brown bottle. So this is the brown glass comparator with a brown glass standard. So it is usually So these are the comparators where we keep this Sally's graduated hemoglobin tube. So these will be marked has grams, which is in percentage, which is in yellow color marking. And also you can also see the percentage, that is 10 to 140 percentage. So this pipette, it also has this hemoglobin pipette. So this doesn't have any bulb. They doesn't contain any bulb. So you should not confuse with WBC pipette and RBC pipette. So and also there will be a thin glass rod which helps in mixing. So this is usually helps to compare with the other comparators of this, and we can estimate the percentage of hemoglobin in the body. So next common thing is Winthrop's tube. So always remember, the Winthrop's tube will be closed at one end and open at one end. So usually closed at one end and open at one end, and the grading, the graduation will be from 10 to 0. So it is basically used for PCV, ESR and also Buffy coat. So it is usually, as I said, Winthrop is a thick walled glass tube measuring, it is around 11 centimeter, and the internal diameter will be 2.5 millimeter, and also closed in one end, open in closed in one side and open in another side. So always remember, used for packed cell volume, ESR and also Buffy coat. So next, so as I said, it is used into packs to know the packed cell volume. So the methods of estimation of PCVs, one is Winthrop methods and also micro methods by using capillary tube, and automated calculated value can also be used. So this is the difference between the Winthrop's and the Western grain tube. So the Winthrop's tube, as I said, it will be open in one end and closed in another end, and the graduation will be 0 to 10. And used for PCV. So whereas PCV, ESR and Buffy coat. So whereas Western tube, so it will be both the ends will be open. So both the ends will be open, and the tube is usually shorter compared to the so Winthrop tube is usually shorter, whereas Western grain tube will be usually longer. So the lower marking will be 180 mm and the border diameter will be 2.5 mm. So the marking will be till 0 to 200 from above downward in its lower two-third. So known as the pipette because it's both the ends are open. Next is bone marrow aspiration needle. So this is Salas bone marrow aspiration needle. So this has the parts. So it has a trochlear, the cannula, and so this is the usually the adjusting part. So it helps to know the depth of penetration of the needle. So indication is usually the bone marrow aspiration, which helps in diagnosing of the megaloblastic anemia, if there is any leukemia, and any other causes like thrombocytopenia, thrombocytopenic purpura, so MPN. So these kind of thing it will be useful. So this is the trocar, and this will be the cannula. So this will be the adjusting thing to know the depth of penetration. So next is Wim Silverman liver biopsy needle. So this also has a 3 parts, but here there is a bifid needle. So it will be usually longer than the needle, and it usually protrudes out. So you have to put this inside, so it will usually protrude out from here, and it has a longitudinal groove. So this edge is basically used for the cutting the tissue. So it will retain the tissue when the needle is taken out and the cannula is removed. So the indication is usually especially used in liver biopsies. If there is any cirrhosis or any carcinoma like hepatocellular carcinoma, so those kind of things, these will when Silverman liver biopsy needle is used. So next is the LP needle. LP needle is the lumbar puncture needle. So it is used in collection and handling of CSF. So CSF is usually obtained by lumbar puncture by using the lumbar puncture needle. So the needle measures around 10 to 12 centimeter in length, and it is usually made up of platinum or German alloy. So usually in children the shorter needle can be used, and also the needle has a stillet. So this is the stillet which is used. So this stillet will have a pin. So this is a pin which will fit into this slot of the needle. So it helps to keep the needle patent. So it is one indication of this is the diagnosing. So diagnosing or analyzing the CSF. So other indication is the therapeutic indication, where especially in spinal anesthesia. So this is this is a brief about the procedure. How do they do? So the CSF sample should be examined immediately. So within 30 minutes. So if there is any delay in examining, then there will be an inaccurate count. So the position, usually the patient is made to sit on the side of the edge of the bed, where his knees is drawn up and also head is flexed. So in adults we use is the third lumbar puncture, whereas in children it will be fourth lumbar space. So then we have to know about the indications of the CSF. So one is if there is any bacterial, viral or fungal meningitis can be known. If any encephalitis or malignant infiltration like acute leukemia or lymphoma, subarachnoid hemorrhages can be known, and also multiple sclerosis, subacute sclerosing panencephalitis, and also spinal canal blockage lead to elevated in intracranial tensions. So these are the indications of diagnosing the CSF analysis. So next, so these are usually the vacutainer tubes. So these color codes, whatever we are seeing, the plastic tube with rubber stalk is basically used to collect the blood for various investigations. So first, the most common type which we use is red color. So usually these tubes will have this anticoagulants in it. So depending upon that, the different test has been conducting. So as we know, there are 13 clotting factors, so in which the anticoagulants will work on one or other factor. So this will usually stop the functions or inactive or remove to precipitate. So it will usually basically does not clot. The blood, whatever sample you are sending, does not clot. So this will have different anticoagulants. So first is no coagulant, that is red, which is more commonly used, and other is purple, which is more commonly used, that is EDTA. So no coagulants, usually serological examination like hepatitis, HIV. So these are usually used where there is no coagulation. So whereas EDTA is usually used as the fourth clotting, where calcium will bind and it will stop the coagulation. So it is used for routine blood checkup like CBC and ESR and all. So other things are the sodium fluoride, where it is used in glucose estimation, and the sodium citrate, where especially used in coagulation studies like prothrombin test and all. And other is heparin, especially in bone marrow studies, and citrate, which is yellow color, where it is used in blood culture, especially in microbiology. And another one is pink color, that is EDTA. It is used in blood bank test or blood typing or ABO grouping. So this is little about the anticoagulants. So ACD is acid citrate dextrose. So its shelf life is around 21 days, and CPD is citrate phosphatase dextrose, which is shelf life of the blood will be 21 days, and citrate will bind to calcium, so the coagulation cascade is inhibited. And also the dextrose is the energy source, whereas phosphate is the increase in ATP production. So now this CDPA. So CDPA is nothing but citrate, phosphate, and dextrose and adenine. So this is usually nowadays used. So where it is used? So basically it is used nowadays in blood bank. So it will usually increase the shelf life of the blood. So citrate is an anticoagulant, whereas phosphate acts as a buffer to maintain the pH. And also dextrose will provide, as I said, energy to the source. And adenine, which we say, it usually promotes the synthesis of ATP adenosine. So this will usually viability or used in blood storage, and also especially in blood transfusion. So basically this CPDA is used in packed RBC to increase the shelf life of the blood bank. So thank you so much. We'll be covering other interesting topic in next coming videos. Please subscribe.